Hello, this is Dr. Gay from First Look MRI. And this is a 73-year-old female who injured her foot, and now she's having pain in the midfoot. The physician was worried about a Lisfranc ligament tear, and so we did the exam here to look at that. And on one of these views here, we can see that. So the Lisfranc ligament comes from the base of the second metatarsal bone. Here's the first metatarsal bone, the big one. Here's the great toe. We see there's marrow edema, so something is going on here. We see the second metatarsal bone. This is the base. So if we look right there, we can see a little oblique dark band that's going from the second metatarsal base to the medial cuneiform or first cuneiform. So this little linear band is the Lisfranc ligament. When this ruptures, this second metatarsal base can drift laterally, and so can the other metatarsals, and they get a midfoot dislocation. But we can see that this is intact, the Lisfranc ligament, and there is no subluxation. It looks like the second metatarsal base lines up with the second cuneiform here. So there's no midfoot dislocation, no rupture, but there's a lot of edema here. If we go along the plantar surface, we see something coming across here, this linear band. This comes underneath the foot, and this is the peroneus longus tendon. It wraps underneath here, and then it comes across obliquely and attaches right here on the base. And this is not torn, it looks intact, but there's edema there. So this may be related to a stress-related injury. It tugged on here and there's stress-related edema, or maybe it's just a bone contusion. There's no articular surface collapse, but definitely a bone injury here without bone displacement or articular impaction. But there's one other thing, there's just a lot of edema over here. So if we go dorsally, we look up here, there's a glob of intermediate signal here. This is the tibialis anterior tendon, or the anterior tibial tendon. This is at the level of the ankle. We're going to follow it distally, and this should come down and be clean, but it's getting a little bit too fat here, a little bit too wide. Here it's indistinct, and right here we just lose it. So from here onto the attachment, some fibers attach here to the medial first cuneiform bone, and some of them attach here to the base of the first metatarsal bone. So the attachments of this are largely torn. It's a high-grade partial tear. Maybe there's some limited fibers still hanging on, but a tibialis anterior tibial tendon tear, high-grade partial tear. This is a T1 weighted image. We can see this as well. Here it is. We're going to follow it down. See the abnormal morphology. Instead of a nice dark ovoid tibialis anterior tendon, we see this V-shaped tendon, lots of signal. And here near the insertion, it's just poorly defined and enlarged, so a high-grade partial tear. If we put up a sagittal view, we can appreciate the same things. This is the anterior tibial tendon here coming in front. A little bit of fluid around it, so we know that something's wrong. It looks a little bit lax. And then we're going to follow it down, down. Looks halfway decent there. And then when we get to these images, it's just thickened, poorly defined. Some of the fibers are intact, hanging on. Otherwise, it would be retracted back further. So you can see a few of these fibers. So we call this a high-grade partial tear of the anterior tibial tendon. And that's it. Thank you very much.